Hi, everybody. My name is Neil Seidman. I'm co-chair of the Public Education Committee for ADAA. That's the Anxiety and Depression Association of America. And hey, welcome to our webinar, Can Virtual Reality, VR, Reduce Anxiety? And we're so fortunate to have our presenter, Dr. Elizabeth McMahon. This webinar is presented by ADAA, which is the leading nonprofit organization in the field of anxiety and depression. And we really want to invite everybody to spend some time exploring our website, adaa.org, just really wonderful resources. So let's get started. I'm so happy to introduce our presenter, psychologist Elizabeth McMahon, has specialized in treating anxiety for 40 years. She has a wonderful self-help book that's called Overcoming Anxiety and Panic, Interactive Guide. Her book explains why people develop anxiety, fear, and panic, what happens in your brain and body, and how you can overcome anxiety and panic. Dr. McMahon has used virtual reality, that's VR for short, since 2010 with many, many clients. She's written a therapist guide on using VR to treat anxiety disorders. She provides many trainings and consultations for mental health professionals. So she really is, we're really, really privileged to have her. So let me turn it over now to Dr. McMahon.
Thank you, Neil. It's a pleasure to be here and a pleasure to talk about something that's so important because VR can just make treatment of anxiety so much easier and so much more effective. It's a wonderful tool. So
Can't wait to hear more about it. I mean, we've heard about the virtual reality for many years, but I'm so excited to hear about how this can be used to help with anxiety.
that's right. It's not just for gaming. Yeah. And I suppose the first question really is, what is virtual reality, right? You know, if you're not a gamer, if you haven't experienced it, you may be wondering, well, what are we talking about? And what virtual reality is you put on some kind of headset. There are all kinds of headsets out there, including inexpensive ones that just hold your phone. But when you put on this headset, it blocks your view of the actual physical environment surrounding you, and instead immerses you in a virtual environment, in a different world, so that wherever you look, you see that world, you see that place. So that if you were on a virtual beach, for example, you would see the sand and the water and the sky. You would hear the sounds of the wind and the waves and the seabirds calling. And wherever you looked, you would be on that beach. So it feels
This sounds kind of fun
real.
if people haven't experienced it.
It is. It really is. And it's got some unique benefits for treating anxiety. Let me just show you a little bit about, we talked about you can put a phone in a headset or you put on a headset. Basically, the screen is split so that one eye sees one version of the environment, one eye sees the other. That makes it three-dimensional, as if you're actually there. And the virtual environment, the virtual world, what you see and experience, can either be created through computer-generated imagery, like this example. It's a generic car, a generic
So I can see,
road.
especially from the hands and the arms, that this is a computer animation.
Exactly.
But it looks actually quite realistic.
It's amazing how helpful it can be, and it's really surprising. The most common comment that I get from my clients is, wow, I didn't expect it to be so real, right?
So this is the computer generated example. that
And
we're
then there's,
looking at now. Okay.
that's right. And you can see I mean, it's sort of, right, this is an avatar, it's not a real person. On the other hand, there's another way to create virtual reality, and that's through actually photographing it or videotaping it with a 3D VR camera.
This looks like
So,
the Golden Gate Bridge, am I right?
yes, it is.
I could tell from the color.
Yep. So this is a VR video of actually driving a real car, driving over a real bridge. So there,
So this is
those,
a more realistic version, but it's the same idea of you're looking at this through a headset and you're getting the sense of being immersed in that experience.
exactly, exactly. And whether it's a VR video or computer generated, if I'm driving the car and I turn left, I can look out the left window. If I turn right, I can see what's on the right. It really is all around you. You're within this world, which is pretty cool.
Yeah.
Yeah.
Okay.
So there are a lot of different ways that VR can be used in therapy. I mean, we hear about it being used for gaming, right? For having, going on roller coasters or imagining that you're, driving a race car or flying in outer space. But it's actually a wonderful therapeutic tool as well. And it's a tool, not a therapy, but it's a wonderful tool. So it can be used in all kinds of ways. It can be used to help you just deepen your level of relaxation, right? It just may be easier to relax if you're there on that beach or in that beautiful forest scene or on that mountaintop. It can help because it's so engrossing, because you become immersed. It can help you soothe and calm yourself. Because it feels real, it increases your emotional engagement. It's one thing if I talk about driving a car if I'm scared of driving, or flying if I'm scared of flying, but it's another if I actually feel like I'm in the car or on the plane. It can also be used to just create positive emotions. When I was growing up, my family would take our vacations at the beach. So for me, going to the beach just brings such wonderful memories and such happy feelings.
Yeah, and I've had feelings like that too. And so I'm remembering a time at the beach would feel really great. With the VR, though, I could actually be in that scene, actually seeing it, hearing it, turning this way and that way. Really kind of an easier way, maybe, of connecting with that experience on a deeper level.
That's right. That's right. And therapists are starting to use virtual reality to create positive emotions to help fight depression, for example. And we're also finding that creating positive emotions helps decrease worry. And then you get to learn or practice new skills. So, for example, in a virtual setting, you might have an instructor talking to you about how to learn diaphragmatic breathing, belly breathing to calm and activate the parasympathetic branch of the nervous system, not the fight or flight branch. Or you might, have an instructor in VR step you through learning progressive muscle relaxation, tensing one muscle and then letting it relax and letting the body get progressively deeper and deeper relaxed. Or you could go through a mindfulness exercise to practice turning your attention in a mindful, focused way, being truly present. So it's a way to learn new skills and to practice them. And it also, we're going to talk about this, I know, it can be used for what's called exposure therapy as a way to face your fears in a way that's realistic, but also safe, and that you can face your fears gradually. And then as you
What would be an example of using VR to face a fear? Let's say I had a fear of heights.
Ah, that's a great example. Well, you know, we could talk about facing heights, or we could imagine that you're at a height, or I could encourage you to go out and be in high places, which you may or may not be willing to do because it's scary. In VR, in the session, with me guiding you and supporting you and talking with you, we could gradually have you go, as you feel comfortable, into higher and higher places.
So I might do that like right away with you in the session, instead of talking for 3 sessions about building up the courage to start going to a high place.
Exactly, exactly. And it's a lot more private and a lot cheaper than having me go with you to a public place and try to do therapy in public. Although that can be incredibly effective, but it is often hard to arrange, maybe not so private, and can be very expensive.
And I'm looking at the word gradually. So I'm thinking, I'm just, kind of guessing what VR might be like for, say, something like the fear of heights. But I'm guessing that this would be something that I could do really in small steps as I'm ready.
Exactly. In small steps as you're ready, Neil, that really captures the benefit of VR. You know, if you're afraid of flying, I can have you just start out waiting at home to be picked up and deal with the anticipatory worry, the anticipatory anxiety. And then when you're ready, we could maybe have you in a cab on your way to the airport. And
Actually
then,
in the VR immersion experience.
that's right. That's right. Right. You'd be on the highway, you'd be seeing cars go past, right? And then we could just go to the gate and just wait in the gate area. You know, maybe look out the window and see the planes taking off and landing. And then when you're ready, you'd get called and go down the jetway. And when you're ready, we'd go on the plane. And with VR, I can control where you sit on the plane, whether you have an aisle seat, a window seat, or a middle seat. I can control the weather. I can control the time of day. I can control the amount of turbulence. And we can just practice takeoff over and over and over and over and over and over and over until it's completely familiar and comfortable.
And one very practical advantage that I'm thinking, if I'm working on overcoming a fear of flying, every time I practice one of these steps with a flight, I'm not having to buy a ticket, right?
Exactly. Exactly.
I love the ability to be able to repeat a challenging step, especially like during the session with your guidance as my therapist.
Exactly. So you're there on the plane, but you also hear your therapist in your ear, guiding you, supporting you, monitoring, checking what's your anxiety level, how are you doing, reminding you to use your skills, celebrating the progress as you make it.
Are there a lot of VR resources for different types of fears? Like we gave a couple of examples of driving across the bridge, or fear of heights, or air travel.
There really are, and there are increasing numbers of what are called virtual environments or VR software programs designed specifically for use in therapy. The last time I looked, there were between 50 to 60 different types of virtual environments, and that's probably expanded by now.
So many of the common fears, there are going to be some virtual reality environments that could be helpful.
Yes, indeed. Yes, indeed. Yeah.
So this sounds all very, very exciting. Let's say that I want to work on one of my fears. It's a phobia, or some other, maybe a social. What about social anxiety? Could this be helpful for social anxiety as well?
It can. There are fewer virtual environments designed for social anxiety, but they do exist. And you could use it to practice starting a conversation, or joining a group and introducing yourself, or you could use it to practice interacting and socializing with a couple of work colleagues around a table before a meeting starts.
So this would give me a way to do exposure therapy, at least to get started with that right in the session with the VR.
And I can control the other people's response to you. Because if you have social anxiety, you're so worried that you're going to say the wrong thing, do the wrong thing, you're going to be embarrassed, or people won't like you. So we can start out with having all of the other people, the avatars, right? The computer generated people, being very positive and smiling. And then we can move to them being sort of, neutral. And then we can even move to them being sort of bored and shaking their head and disagreeing. So it's a chance to practice everything that might happen so that you feel prepared.
So I'm facing my fears.
So you're facing your fears.
I
And
love that ability in VR. Let's say my fear is I'll go up to somebody and start a conversation and they'll give me a scowl. Well, but in VR, could I actually experience that in a VR?
Absolutely. And then we could talk about it. Maybe they're scowling because they have a bad day, maybe because they're in pain, maybe because they just learned that they're going to be laid off. Maybe they're just a scowly person.
Right. Okay. How about public speaking? Is there any environment for public speaking?
I love using it for public speaking because you can choose, you have options for the different types of audiences. And again, I can control the audience response to you. So we deal with the worry about it and the fears, and then how you're going to talk back to your fears. Really, no matter how much you bomb in public speaking, most people won't care, and nobody's going to go and lynch you. The outcome just isn't that bad. And you learn to turn your attention more to why you're actually giving this talk, why it's important to you, and why you have something to offer. And whether the audience accepts it or not, that's up to them. But your job is just go and share what you know. And shifting that attention to your goals and your values, and away from trying to guess how people are responding, makes a big difference. And being able to accept however they respond is how they respond.
Now, in the intro, when I introduced you, I think, was it since more than 10 years you've been working with clients using virtual reality for things like fears and phobias? And
I have since 2010.
wow.
I saw the research literature about it in 2008, did a lit review, and I thought, oh, as somebody who specializes in anxiety, I have to have this tool. I want this. This is as exposure in VR is as good as the gold standard proven effective exposure in real life. It's like, wow, it was kind of a Harry and met Sally, I'll have what she's having moment.
So this is an evidence-based approach.
It is. So it's used with all kinds of anxiety. And I'm going to talk about what the research says, that when you go into VR, even though you know it's not real, you still tend to react emotionally and physically because it feels real. And therefore, it lets you have experiences that have impact on you, but that are controlled, right? It permits impossible experiences like controlling the weather, right? Like repeated takeoffs, and with your therapist there with you so that you're sort of in the situation, but you're also with your therapist. And it bridges that gap between talking about something and doing it. And if I can just share some examples from real life, Here are the kinds of changes that can occur, changes that occur in the virtual world, generalize and transfer into real life. So after driving in virtual reality, this client started driving over the high places, the bridges, the hills, the highways, eventually without even noticing. Or this person, this client who had terrible driving fear and a bunch of other stresses and a trauma history, came in to get over the fear of flying, ended up taking several international flights, flew for the first time without needing medication, and said, for the first time I watched a movie, I relaxed, I slept. And it just feels great to overcome your fear, because you don't really believe you can do something until you do it. But to kind of intellectually know it's okay when it still feels scary, that's a big ask. That's a big jump. And VR lets you get that experience of, I can do it. Lets you practice until you're confident.
And it lets you experience the, the emotional level and what you see and feel and hear. And
Yes. Yeah. Yeah, it does. It does. Well, and as you know, there's nothing more exciting than seeing someone overcome a fear, learn how to cope with fear. It just opens their lives.
how can somebody find a therapist that maybe doesn't have your background, but has some of the background to be able to do this virtual reality exposure work with?
Well, there are a couple of places where you can look to find a therapist, a licensed mental health clinician with the training in the background, right? Who also uses VR. So you want someone who has experience and training in treating anxiety disorders, right? And then increasingly, therapists are beginning to adopt VR and offer that as a tool. So you can go to the websites of ADAA, right? You can go to the website of the Association of Behavioral and Cognitive Therapies, abct.org. You can go to the websites of the professional organizations like the American Psychological Association or your state psychological association or social work organization or marriage family therapist organization. All of these websites have a button, a tab that has a find a therapist or find a psychologist option where you can set some filters. And one of the filters is you look for the people who treat anxiety, and then you see, do any of them say that they use VR? It should be highlighted on their website because this is a new, exciting tool. The other place you can go is that there is a website specifically with a listing of therapists who use VR called VR Therapists International.
VRTherapistInternational.com. Dr. McMahon, I understand you're in California.
I am.
So for people in California, how can they find your website?
My website is my name, Elizabeth-McMahon.com. I'm going to go back to, there we go.
There we go.
So Elizabeth-McMahon.com. And if you are frightened by the experience of fear or panic, if that experience frightens you, right, then you might want to, the first step, you might want to start out by just getting Overcoming Anxiety and Panic interactive guide to kind of understand what's happening in the body, why it's not dangerous, what's causing each of the physical sensations, and how they're trying to help you, and to just sort of step you through a very clear research and clinically supported process of getting over the fear of fear.
Wonderful, wonderful. Oh, here's a question that I wanted to ask you. So occasionally I hear about people that when they use like VR for gaming, maybe especially little older people might experience some nausea or motion sickness. How common is that if someone wants to do VR therapy?
Right. It's more common in the extreme VR because you're moving around and it's very fast and it can be very jerky and you know, your eyes tell you you're moving and your body tells you you're different, you're not. And that disconnect can really create nausea. That being said, in my clinical experience, where I'm not going for some extreme gaming experience, it's really very rare. I've only had a handful of clients who have actually not been able to use VR because of nausea.
So the experience really has maybe a different design than a game
It does.
where the movement isn't going to be nearly as extreme. The idea of using the VR for therapy is to give me that more immersive emotional experience so that I really can start my exposure therapy
Yes.
instead of talking about, I want to do this.
I know I ought to
Actually
do
do
this.
it.
I know it's safe, but it still
Right,
feels scary.
right, right. Wonderful,
Yes.
wonderful. Well, thank you so much, Dr. McMahon, for sharing all this information with us. And I want to invite everybody that's watching to visit ADAA.org, explore other resources. You can support ADAA by making a charitable donation on the website. If you have a question after watching this presentation, you can send an email to webinars@adaa.org. And thank you, everybody, for watching. Thanks again, Dr. McMahon.
Thank you for having me. Take care.